Hey there, this is Dr. Jiwa Lee with my daughter and handy assistant Simone.
Hi guys.
Today I'm going to talk about carpal tunnel syndrome and what to do for that conservatively. You want to do this before contemplating carpal tunnel syndrome surgery. And the reason why is because I believe that you really should exhaust all of your conservative options before you even consider surgery in everything. So that's massage, acupuncture, chiropractic, whatever, myofascial release, all those things should be looked at before doing surgery. Because once you start cutting, you can't go back. So carpal tunnel, the carpal are the bones of your wrist. Bones of your wrist. Actually, I'll hold mine up. You can see mine better. The bones of the wrist. They're actually two rows of bones that are like irregular shaped pebbles that form your wrist. And there's around 7 bones altogether that make up the wrist. And it allows for is for you to be able to do this. So it's much more than a hinge joint like your finger or your knee. It has more range of motion, so that's why you have all of these little bones in here. Then on the front side, you have these ligaments that go across. And on me, you can actually see the tendons of the muscles that go in underneath these ligaments. And these ligaments form the roof of the carpal tunnel. And so what they do in surgery is basically they cut these ligaments and free up this space so that so the nerve is not impinged or irritated. Well, the problem is that really doesn't address the issue. Carpal tunnel is an overuse injury, and the overuse that's taking place is being stuck or doing this motion all day long. So if you're on a keyboard, if you're driving, if you're doing some sort of handwork that has your wrist in this position, this is what's causing the overuse, this position here. And so when you're in this position for a long time, you have certain muscles that lengthen and certain muscles that contract. And so the muscle that contracts with this, in particular, that's the focus, is extensor carpi radialis. And so if you look at your hand, your wrist like this, the thumb side is the radial side, okay? And so the muscle that goes all the way up to where your elbow, right above your elbow, there's a little knob there on the side. And that's where that muscle begins. And it can be tender when you touch it. And see, she's making faces because it is tender. And most people are really surprised how tender this muscle is because they never touch it, never really have a reason to. But this muscle is being overworked and it's causing tension across the wrist or the carpal bones that form the wrist, and that's what's causing the irritation of the nerve in the carpal tunnel, this muscle being tight. So we want to stretch it. That's just as simple as that. You want to stretch the offending muscle, okay? And so there are a couple ways you can do it. You can take some massage oil or lotion, and you can start on the thumb side. You want to start at the top, at the beginning of the muscle, and you're going to massage all the way down, all the way down. I hope you can see this. All the way down, all the way down, all the way down, all the way down. See her thumb's on this side? And then you can go all the way down, just like this, all the way down. And while you're doing it, might as well get all the other muscles in the wrist because they're probably not getting much love anyway too, okay? And then what you want to do is you want to do the exact opposite of this. You want to do this. And this will help stretch the muscle, but you want to stretch the whole chain of the muscle. And so you want to do this and then bring your arm back, extend the arm back. So Simone's doing that. She has her wrist down, and then she's bringing her arm back and behind her, and she can feel the stretch. Feel it? Mm-hmm. Okay. And you just keep on doing that. And then if you have a friend or someone, a loved one who can do that, you're just going to just massage the wrist, the 2 bones in the wrist, and just move them back and forth a little bit. And then you move your wrist and mobilize these bones. chiropractors who are trained in adjusting wrists know how to do this quite efficiently, but make sure that they have training and they understand how to adjust the wrist. There are several ways of doing it. The way that I was taught, I'm not going to show because then you're going to try it and you're not a trained professional. And so I'm not going to have you bastardize the art of mobilizing bones by thinking, oh, I saw it in a video, I can do it. I'm not going to do that. So you want to go to a chiropractor who knows how to mobilize the wrist in a way so that the individual bones are moving fluidly and that you have great range of motion. You can actually tell the difference after having it adjusted. But if you can't get it adjusted, doing the massage is a great way of alleviating that tension and the irritation. If you want to do ice massage, you can do that. You can take a Dixie cup, put water in it, like the ones that you have in the bathroom, little Dixie cups, paper Dixie cups, fill it with water, put it in the freezer, and then once it's frozen, tear back the paper, and so the ice is exposed, and just ice along this area in here all the way down. Okay, so I hope that helps. If you have any questions or you want to consult online, I do that. We do it via Zoom. You can go to drjiwa.com/schedule, and you have my schedule and you want to set up a 20-minute consult. Then also hit the subscribe and hit the bell so you can get notifications, because I'm going to be doing more of these insights on what you can do to alleviate these pains that most people have: wrist pain, knee pain, shoulder pain, back pain. So stay tuned and I will see you soon. Have a great day, everyone. All right, bye.